Joining us via Skype from Abuja is a medical doctor, Dr. Obinna Ebrim. Thank you for joining us on the show now. How worried are you that this is going on at this time in Borno State? Should a state of emergency be called in the health sector?
Yes, good morning. I think a state of emergency should be called in the health sector, not just because of the cholera outbreak as we see in Borno this period, but also for other things that are happening around the health sector. For example, recently a survey was done and it was revealed that only 33% of our eligible children are getting the vaccines they need. And the funding in the health sector has also been low. We are yet to meet the 15% Abuja declaration. So a sum of all these requires an emergency in the health sector.
All right, Dr. Obinna, can you certainly give us, paint a picture for us that how bad a situation is that even is giving rise to an outbreak of this magnitude in IDP camp?
Okay, so we know that cholera, the outbreak of cholera is high in areas with poor water, hygiene and sanitation. And that is not to be unexpected in a place like the IDP camps and areas that are coming out from insurgency and crisis. So such breakdown of water, access to clean water, a poor hygienic situation and sanitary conditions, it's expected that such outbreak will happen. As you know or you have heard, the transmission of cholera is through fecal-oral, that's through the mouth into the body, where it then causes secretory diarrhea. That's a lot of watery diarrhea. So in areas like IDP camp, it is expected, and one should prepare for that by trying to communicate good hygienic practices.
All right, so some measures have been put in place by the government to check the problem, and then vaccines, of course, are being given to some of the people now. It started just 2 days ago, but will these measures control the problem because it's already spreading?
Yes, I believe that the outbreak response that has been mounted in Borno would control the situation. We are aware that as at Monday, there is an oral cholera vaccination campaign started in Borno State, and more than 900,000 persons will be vaccinated. And we know that the cholera vaccine has up to 85 to 90% protection, I think, for the next 6 months for those who receive vaccines. And with other interventions ongoing, active surveillance, deployment of treatment, drugs, and personal protective equipment to health workers, and other coordination activities that have been happening in Borno State with the National Center of Disease Control, working with the international partners and the State Ministry of Health in Borno State. We are optimistic that the outbreak will be controlled.
All right, Doctor. Well, from the figures we got, Maiduguri alone recorded about 1,426 cases, Dikwa about 600, and Mongono about 600 cases. Now, make us understand, how just complicated are these issues when, should we blame it on negligence, or is it just a security situation that we have this kind of case where about more than 40 people have even died so far?
So I wouldn't blame it on security. Security is just a factor that led to the breakdown of some of the, like say, infrastructure that would have been in place. But what happens is that because it's highly contagious, and especially in poor areas with poor sanitation and hygiene, once it then someone gets infected, and there are no good defecation facility, and people do not have good hygiene, they don't wash their hands frequently, then they pick up this bacteria, and maybe through drinking water, eating with hands unwashed, they then introduce that into their body, and it begins to spread very fast because of the poor sanitary condition around there and the poor hygiene. So, so it's a combination of a lot of factors, security being one of them that includes sustainability. There are also other issues like malnutrition in ID camps, which is known to increase susceptibility of cholera outbreak. But what is important is that once these cases are observed, and they should be observed early, so there should be active surveillance that detects such outbreak early. What is now important is the outbreak response that you mount. There should be coordination of our activities to ensure that everyone is brought on board to rapidly deal with the situation. As I said earlier on, the vaccination, the oral cholera vaccination that is ongoing is one of them. Communication also, active communication to and sensitization of the public to adopt good hygienic proper attitude like washing of hands, ensuring that you clean boiled or sterilized water is provided for people around the camp and all that. These are the things that are very necessary at this point to ensure that you stop this outbreak of cholera. So it's a combination of various factors, but what is important is not to blame the factors. What is important is what are these active response that you mount to curtail the outbreak.
All right, tell us, doctor, now the incubation period of the cholera bacteria in the body of the host before it becomes fatal.
So you have up to a few days to about a few days. Yeah, it's not something that has a long incubation period when it gets to the body, because the pathology is quite clear. Once it gets into the body and gets into the intestine, then the enterovaccine causes rapid secretion, and that rapid secretion is what causes the acute watery diarrhea. So the person comes down with frequent stooling, loss of fluids, loss of electrolytes, and if that is not controlled, the person can go into shock with severe dehydration. So it's quite clear, it's a clear pathology, and the incubation period is quite short.
All right, doctor, we understand that there are several international agencies working in there, where the Doctors Without Borders is there, the Red Cross and other organizations are helping. But in all of this, what role precisely, specifically, would they be performing with these people generally and helping to ensure that people get help and get awareness, in fact?
So, as I said earlier on, there is need for public sensitization on good sanitary practices, good hygienic practices. So at this point, open defecation should be discouraged. People should wash their hands. People should not just drink from any source of water. They should drink clean, boiled, or sterilized water. Then also, this international organization, they also help in the vaccination campaign. So vaccination campaign is not just about dropping that oral vaccine. There are a lot of planning, a lot of coordination that needs to happen. Then also in case management, so it's important that cases are identified quickly, sent in to the outbreak response center or hospitals, and adequate rehydration and antibiotic treatment commence immediately. So these are things that need to be done very fast. The government cannot do it alone because of the numbers we are seeing, and they need the support of international partners. And really, I must commend the government at this point, because from the reports we've been getting, the response has been good and well coordinated. And we are very hopeful that in little or no time, this outbreak will be curtailed.
All right, let's look at what is supposed to be the norm, you know, breaking away from solving the problem to prevent the problem in the first place. Nigerian governments and authorities, most usually in the country, are accused of engaging in fire brigade approach. So normally, what is supposed to be the norm when you put internally displaced peoples in camp, or people rather in camps, or refugees in camps? What are supposed to be the basics really to take care of their medicals and all that to prevent, because these are envisaged that it could happen when you put different people into one common open place.
All right, rightly said, medicine is moving away, or healthcare is moving away from curative to preventive medicine. And recently I visited the IDP camp here in the SCC, although it's a long time ago, about 3 months ago, and the reports I got weren't good. I heard that the people there had to go to a nearby bush just behind the camp to defecate. I think there is just one one overhead water supply system that was recently constructed. So really, we must do more to prevent some of these outbreaks. And common ways are things like sensitizing people in the IDP camp to adopt good hygienic practices. And on our own part, as not really on our own, I think on our own part, both government, partners, stakeholders, we should then do more to ensure that there are adequate infrastructure that curtail some of that. I think like provision of clean water in IDP camps, provision of toilets, good toilet facilities to avoid open defecation. Then sensitization, health education, all these are preventive strategies that could prevent or even control these outbreaks so that when they occur, they are not, they don't happen to this magnitude.
All right, you just painted a picture briefly of the camp you visited in Abuja, some in the FCT sometime. Now we know that several people in the IDP camps are still on admission from the cholera outbreak down with the infection. But as it is, with the condition on ground, do you think that the death toll could rise beyond where it is right now?
So as I said, what is expected really right now is a decline. And I'm saying it with a high level of certainty because I know that vaccines work. I'm a vaccine champion. I know the power of vaccines. And since the oral vaccination campaign has started on Monday, and I know that the vaccine, the oral cholera vaccine, can protect up to 85 to 90% of those who receive this vaccine in the next 6 months. So I believe that with a successful vaccination campaign, we are going to protect the community in Borno State from getting this cholera disease, really. So I'm optimistic that there will be a decline in death toll with this part of the vaccination campaign, which we know would protect the community in Borno State from getting this disease, this cholera disease.
Just a few months ago, it was the problem of cerebral spinal meningitis that some of them were battling with in the northeastern part of the country. So why or how important is it for the Nigerian government now, especially at the center, to begin to give health more attention in the area of research for Nigeria to develop its own vaccines for almost all these ailments and not depend wholly on WHO for vaccines almost every time? WHO is even involved in giving this new set.
Okay, so you're completely right. Personally, with the data available to me, I don't think that we're putting our money where our mouth is. So with a high infant and maternal mortality rate in Nigeria, we should pay, health should be a priority in Nigeria. But based on the financial allocation in the budget, which is less than 5%, you can't say that you're giving health a priority, and that is saddening with what we're seeing. So I think the start point is allocating adequate funds to health, and there is a standard. In 2011, we all came here, brought African countries, and agreed to allocate 15% to health. Up to this moment, we have not even done up to 50%. And as stakeholders, we have called on government that in the 2018 budget, they should allocate at least 7.5% of the entire budget to health. That's the start point. Then the program, with that fund, we can then commence adequate research to ensure that some of these medicines and technology are then produced domestically and also capacity enhanced. And I think also that we should, as Nigerians, we should also support the government, because a situation whereby just 33% of eligible children get the vaccines they need, it's not good. And you can't say it's just the government. Government has been providing vaccines for up to 80% or more of the population, and just 33% are just accessing it. So I think it's a concerted effort of both government and the people of Nigeria to take health seriously, to make health a priority in their investment, in their uptake of health service, in their health-seeking behavior. These are key factors that, if dealt with, would improve the health of Nigerians. And the state, which it is at the moment, is a state of emergency, and it calls for attention from everybody, government and the public.
All right, Dr. Obinna Ebrehim, medical doctor, joining us on Skype from Abuja. Thanks for talking to us on TVC Breakfast.